Welcome to the first episode of WHAMcast, a podcast by the Women's Health Awareness Movement, aka WHAM, where we shed light on a range of important health topics for women. Today, we're joined by Dr. Luu, a leading cardiologist specializing in women's heart health and an innovative clinical researcher at McGill University. Dr. Luu brings a wealth of expertise in cardiac MRI and a strong passion for health equity, working to transform how we diagnose and treat heart disease in women, especially those in underserved communities. We're so excited to have her here with us today to discuss how we can better tackle heart disease in women. Dr. Luu, welcome to the show.
Thank you so much for having me, Derek. It's an honor for the WHAM community out there to be your first podcast for women's cardiovascular space, and truly a privilege to be here to share everything I have with you.
And thank you for coming here. We're honored to have you here today.
So excited.
Just before we begin, we want to acknowledge that while this podcast focuses on women's heart health, we recognize the importance of using language that is inclusive and respectful. The information shared may apply to cisgender women, transgender individuals, non-binary and intersex people, or anyone assigned female at birth. We acknowledge that gender and sex are distinct, and we encourage our listeners, especially healthcare providers, to approach conversations about gender identity with openness and sensitivity, tailoring care to each person's unique needs. Now, let's begin with the podcast.
So excited.
So, to start, what motivated you to specialize in cardiovascular health for women? And I guess, what led you to explore the connection between race and heart health?
That's an excellent question. I think it's so important about a mentorship, guidance. When I was in my second year of cardiology training, I went to a conference that was based out of Ottawa for the Canadian Women's Heart Health Alliance. And I remember going to the conference that was was specific to women's heart, and the keynote speaker was a woman by the name of Dr. Noelle Berry-Mers. She's the director of the Women's Heart Center at Cedars-Sinai, and she gave this compelling talk about the disparities in heart disease, how it's underdiagnosed, under-researched. And when I met her, I just knew immediately, when I saw her give the talk, I knew immediately that I had to follow her and train under her, and that's what I did. I approached her, I said, do you offer a fellowship? And, I had a glimpse of what it was, but when I did my training in Cedars-Sinai, I was opened to so much more about the disparities in women's heart health. Specific to race and ethnicity in the U.S. And in Canada too. There's so much, I don't want to use the word structural racism, but a lot of discrimination towards minority ethnic populations. And as a woman, I would call myself a woman with lived experience. I shared it during one of the presentations that I gave, but myself, I'm also of a Vietnamese background, but we're refugee immigrants. I was born in a refugee camp. My parents were Vietnamese boat people. And so growing up, I understood exquisitely and intimately the discrimination and health disparities that can happen if you don't speak the language, if you come from a lower socioeconomic background, if you're a minority population, if you're more underserved population. And so everything that I do comes from a very purposeful place, and I'm so happy that I'm able to give this opportunity at McGill University to really, really make it a vocation and a life purpose.
That's amazing. And here you are today doing amazing things for so many women out there.
Right.
Wow. And I guess just to kind of get into the nitty gritty of it, we often hear that heart disease is a man issue, but we know that's not true. Dr. Luu, based on your expertise, how does heart disease present differently in women? And what are some common misconceptions either your patients have experienced or you have experienced?
Yeah, so heart disease is ubiquitous. It affects everyone. And specifically in North America, heart disease kills 1 out of 3 women. So not affects 1 out of 3 women, but will actually lead to mortality in 1 of 3 women. It's on the rise. It's next to cancer. And specifically in the premature, what I call younger population, women under the age of 65, heart disease is on the rise. So you can be a young woman and still have, heart attacks, strokes, your heart failing. Women can present, there's lots of misconceptions, but from a biological perspective, physiological perspective, the hearts of men and women are different. Women, compared to the body surface area, have smaller hearts. They have different patterns of heart disease that can happen. And importantly, their symptoms when they present with heart disease can be very different. It's not, if you're having a heart attack for a man, it's not the classic chest pressure radiating to your jaw or your left arm. For a woman, she can present completely differently. It could be fatigue. It could be, epigastric abdominal nausea, and it could be back pain. I had a woman last year in the Emerge. She came in and she had symptoms of heartburn, and she sat on it overnight thinking it would go away, and it didn't. And she came in the next day. It was a very large heart attack. And so I think it's important that we recognize that heart disease affects everyone, and that men and women can present very differently.
And it's scary because you're saying these are not just old people, they're
That's
young
right.
individuals as well.
That's right.
Wow. I guess to bounce off of that, and what about how do the different stages of life influence this, whether it's pregnancy, menopause, or various hormonal changes many women go throughout the life cycle? How do you think those impact cardiovascular health?
That's an excellent question. So I often teach in my training to my students and to my patients, being female is a gift, but it also comes with a biological underpinning, or having ovaries, a uterus, that can affect throughout the reproductive lifespan of a female. Different stages of that reproductive lifespan, we can encounter challenges or problems that can lead to increased risk of heart disease. And what do I mean by that? So for a pregnant woman, I tell them that pregnancy is not net health neutral. It's not net neutral, health neutral. Meaning you can have complications that can lead to increased risk, if not fourfold increased risk of heart attack, strokes for that woman. They've shown in really good observational data of over 1 million women that if a young woman presented with things like gestational diabetes, gestational hypertension, preeclampsia when you have high blood pressure, and having to deliver early before 37 weeks gestation, these adverse pregnancy complications or adverse pregnancy outcomes can lead to accelerated heart disease. In a woman, they showed that the earliest you can present is about 10 years out. So if she was pregnant in her late 20s, let's say 27, 28, she could present as early as 38 with a heart attack or a stroke. And that's incredibly young. And so that's, the pregnancy can bring itself complications or risk to the woman. And additionally, menopause. So we're learning more and more that early onset of menopause, on average, menopause should occur. So menopause is the cessation of your estrogen, and when it withdraws, and it comes with an entire transitional period of metabolic changes, different fat depositions, different hormonal changes. But if a woman went into menopause earlier, before the age of 50, she also has what we're showing accelerated risk of heart disease, meaning, increased aging of her heart, increased risk for heart attack, strokes, etc. So these are just the tip of the iceberg of what we call female-specific risk enhancers, meaning they're not risk factors that you can change like diabetes or smoking. These are risk enhancers, meaning if you've had an adverse pregnancy outcome, if you went into menopause early, it makes your overall risk profile higher for heart disease.
Wow, and this is something that we can change, whether it's menopause or pregnancy. So it's so important, I guess, tackle how we can prevent these issues from arising so much later on in life. So I guess when it comes to risk factors, I know we kind of touched upon it earlier, but what are some of the most common ones, would you say, for women? I know you mentioned before for men, they feel more chest pain, whereas women, it could vary. So how do you think women experience heart attack symptoms? Is it really different? Are there
different risk factors? Yeah. So when we talk about cardiovascular risk factors, there's traditional ones like diabetes, high blood pressure, smoking. They impact men and women as well, but we're finding what we know is that there's a differential impact of these traditional risk factors for the women. So for example, if you're a woman with diabetes, you're actually 2 times more likely to have heart disease than you are compared to a man. A young woman who smokes is almost young woman, like let's say under the age of 50, is 4 times more likely to have a heart attack if she smokes compared to a man. And then we're in really good studies coming out now, the blood pressure targets they're finding for women should also be lower. normal blood pressure should be under 120 over 80, but they're showing that for women, it should actually be under 110 systolic blood pressure. So you can imagine that this knowledge is not being widely spread and not being perpetuated. So there are many, many women in their practice, in outpatient practices, that aren't being treated for blood pressure to target. Additionally, females, and due to their biological makeup, do have other risk factors that are more prone to females. So things like autoimmune diseases, lupus, PCOS, or polycystic ovarian syndrome affects women more. And if they do have these conditions, it also accelerates their heart disease. So across, all the risk factors, I forgot to mention about, one of the most important risk factors, and it's often so tabooed and not discussed, is the concept of psychosocial stress. So mental health related, women carry a higher burden of psychosocial stress and the manifestation of that. So anxiety, depression, and the extreme case of that, suicidality. It affects young women much more as well. And if you're under the age of 65, or if you're young, stress, the concept of stress, meaning chronic perceived worries related to your life, your relationships, work, etc., whatever it is, stress becomes the top 5 biggest risk factors for a heart attack. And so it's so important that we don't take a one-size-fits-all approach when we counsel our patients, because the woman can present not only differently, but her risk profile is so much more complex than that, and it requires quite a bit of education.
Wow, and that's not only important for many women out there to know, but many physicians and other individuals to really realize that there are differences that we should all be aware of.
100%, yeah.
So I guess now that we understand how heart disease impacts women differently, let's talk about the barriers that women often face when it comes to getting the care that they actually need. As you mentioned, heart disease in women is often underdiagnosed or misdiagnosed. So Dr. Luu, what do you think that women can do to advocate for their health in these situations?
Yeah, it's quite unfortunate, the under-recognition, under-support that women get in the heart space, and we see it on the day-to-day in our practice too, here at the MUHC. We're a tertiary world expert center, but women can present very different pathologies of heart disease. They can get what we call microvascular disease or small vessel disease. They can get heart attacks despite having found no major blockages in their large blood vessels, called MNOCA, or heart attacks with no major blockages. And when these women encounter these diagnoses, not only is there a major diagnostic conundrum, meaning right now this clinical equipoise, we're unclear of how to properly diagnose it. There's also clinical equipoise, meaning an uncertainty of how to treat it. But the prognosis, unfortunately, is very clear. Like if you're a woman and you've had a heart attack with despite no major blockages, your risk of dying at 1 year is 5%. And at 5 years, it's 10%. 1 out of 10 chances of dying at 5 years if you've had a heart attack despite being told you have no major blockages. So what I often, and we're trying to do through our research initiatives here with the Power Hub, which we'll talk about later, it's so important that not only we, one, advocate and do our part to raise awareness and educate, but I also use the word intentionally and strategically, is that the woman needs to feel empowered that she can also advocate for herself. As if she does, feel like she's having heart symptoms or something is off, it's okay to present to the emergency, or to talk to your family physician, or to talk to your healthcare providers. And if they feel like they're not being listened to, or there is still dissonance, or just misunderstanding, then I believe that woman needs to feel empowered and just to continue to advocate and to push, I do have real symptoms. Like, can I get a second opinion? Go to the emergency if possible, and then to also seek. There's a lot of resources that are now available, and then with that comes more education to the healthcare providers.
Thank you for that. I think it's really important that women are aware of the resources that are out there for them to, I guess, be able to approach different physicians when they do feel all these symptoms of a heart attack.
Yeah.
I feel like they're being heard, which is, I think, the most important part as physicians or future
it's so
physicians.
Important. Yes.
So I guess along with advocacy, we know that there are many factors that can affect a woman's health, like race, ethnicity, and cultural background. You touched upon also psychosocial stress. So how do you think these factors will impact women's cardiovascular health, and what do you think we can do to address these specific disparities?
That's an excellent question. You're getting at such a important topic. Lots of complexities. Our understanding of social determinants of health, meaning or psychosocial stress, like all, I don't want to group it together, but they're all in this under the same similar space. Social determinants of health, things like your education, your income, your perceived safety in your environment, your social supports. We know, 100% that these do impact heart disease for everyone. But for a female, you can imagine that if she's having heart disease symptoms and she's carrying multiple jobs, single mom, going through domestic violence or history of trauma and discrimination, that this burden carries a higher risk of heart disease for her. And they've shown that if you're a woman and you've had domestic violence, you're actually at much more increased risk of heart disease than you are compared to a man. In our own research, we've shown that despite men and women both having high levels of stress, chronic perceived stress related to work-life balance, whatever it is, that the woman and in her heart, using our MRI, really advanced MRI imaging, there's already evidence or markers of abnormal changes related to inflammation in her heart. And so whatever it is that's going on related to these burdens from psychosocial stress, from your perceived, I don't want to call it like disadvantages, it is impacting the woman's heart more, and we're just honing on it now. There's other studies that have shown that if young women who present with heart attacks, one of the major risk factors that predicted that was her perceived increased household chores at home. And so there's a lot of what I call gendered related aspects, not related to the biological sex of being females and having X chromosome, but everything related to gender, the cultural norms, the expectations, and on that topic, if I may, I teach this to my residents and our students, is the concept of sex and gender is so complex and so intricately related. But there's no better way to explain it. I have this quote from one of the experts in the women's sex and gender space, and the concept is related to understand sex and gender is, the ability to undergo pregnancy and menopause is a biological sex concept. The perceived expectation to have children and the expectation of how to be a mother and how to rear those children and is a gendered concept. And the two intersect. On top of all the other factors, social determinants of health, psychosocial stress, there's a major intersection that leads to increased risk of heart disease. And we're just at the tip of the iceberg into understanding how all of that drives heart disease for women.
That's amazing. And now that we understand it, hopefully we can take that in the future,
right.
Help them with it.
Right.
So I guess we've touched upon that. It's clear there are many challenges many women out there face, whether it's in their control or not. But there's also proactive steps women can take to improve their heart health. So for women looking to reduce the risk of heart disease, what do you think are some lifestyles or habits women can do that have been proven to maybe help their heart health?
That's a really excellent question, and I often, in my practice when I counsel my female patients, I talk about things that are risk factors that are modifiable, meaning we can change, and risk factors that we can't modify. Things that we can't change, unfortunately, is your age. Age is a major risk factor for heart disease for everybody. I can't change the fact that you're female, and I can't change the fact that you've undergone pregnancy, let's say, and had adverse pregnancy outcomes. And then your genetic makeup, whatever it is that the underpinning of your makeup of your heart. But there are multiple modifiable risk factors that we can change, and that is really the cornerstone and the foundation of a healthy heart. Things like, diabetes, optimizing your blood pressure, not smoking, diet and exercise. And what I mean by that is, prescriptively, I tell my patients, exercise isn't going for a gym membership. You don't need to spend exorbitant amount of money to wake up early, to use the gym equipment. exercise and it can be as simple as an intentional and purposeful effort to introduce mobility into your life every day, to introduce increased activity into your life every day. And what that means is that you park far so that you can walk, those few extra minutes to get to your destination, that you take the stairs instead of the elevators, and that when you're watching TV, that you don't sit sedentary, that you do squats, you do arm exercises, or you do some jumping jacks while you watch your TV. You stand during your meetings, and they're actually showing more and more that after every meal, if you're able to walk just 10-15 minutes, or do a series of squats even, but 10-15 minutes walking after each meal is enough to help lower that insulin spike so that you don't have increased fat deposition and associated, and you can use that energy right away. So 10-15 minute walk after each meal adds up to 30 minutes a day of activity, and that is just that is also enough. Does it meet the entire exercise prescription? No, but it's just an intentional effort to optimize your life.
What you mentioned about just walking up the stairs is something so little that people could do every day to, I guess, reduce their heart risk and reduce their risk of heart disease. Are there other lifestyle factors? How can they do that, I guess, in terms of diet?
Yes. Diet is a really important topic. There is lots and lots of studies in the nutrition space of what is an optimized diet. From a cardiovascular perspective, we recommend a Mediterranean diet, high in good fats like olive oils, avocados, minimizing, focus on lean proteins, fish, chicken, beef is okay too, and plenty of vegetables. There is also an understanding of not a caloric restriction, but eating within your prescribed body weight. So it's not excess eating. There's many ways to allow a caloric restriction, whether that be intermittent fasting or just simply eating less. And more for women, it's so important that as they age, there's a concept of what I call sarcopenia, which is the age-related muscle loss. Muscle mass is so important to overall health, your ability to exercise, your bone health. And they're showing more and more that the protein intake is so important for a woman. We don't get enough of that. So, there's so many protein sources like eggs, Greek yogurt, meats, but for a woman, it's so important to have that age, ideal age related protein intake. So for me, I take about 0.5 grams of protein for my ideal body weight, and if I need to, I do supplement with very clean protein, whey protein isolate, so that I can optimize my overall health. I think diet doesn't need to be complicated. It doesn't have to be expensive either. It's just cooking at home, minimizing takeout, which does have a lot of salt. Salt is not a bad key, but a lot of processed ingredients. And if you cook at home and make that effort to eat clean at home, not only is it cheaper, so less expensive, but it's cleaner, and it's overall improving the inflammation or whatever is going on in your heart. And so diet, again, isn't going on a fast. It isn't buying meals from set companies, but it's just an intentional, purposeful effort to eat cleaner foods and to cook at home when you can.
And I feel like there's a common misconception that medication can almost compensate instead of doing all these lifestyle changes in their lives. But do you think that there is a benefit to doing medication over lifestyle, or prioritizing lifestyle changes?
Yeah, it's an excellent question. I share it all the time in my practice, is that for, like I said, the foundation and cornerstone of a healthy heart and everything that we do in cardiology, are these lifestyle changes. And I mean, to introduce mobility, to eat well, to minimize your stress, to sleep well. And I tell my patients, and I'm a cardiologist and a physician, I do prescribe medications, but for every single medication that you take in, there is a benefit and there's also a negative, a con. There's a pro and a con. There are side effects that happen with medications, and there's no medication that you can take that could save your life if you have unhealthy lifestyle habits. There's no point in taking medications if you're still smoking. They're not that there's a point, but it's a negation of that. And so they've shown in clinical studies that if you're able to exercise, lose your body, 10% of your body weight, or optimize your overall heart health, you will lower your blood pressure. You will improve your sugar, your glucose intolerance. And so it's so important. And on top of that, the final risk factor that's so hard to mitigate is stress. I tell patients you're having a lot of stress in your life, and I have women in my practice who had heart disease because stress is one of the major risk factors. And it's hard to tell someone do something to optimize your stress, but they're showing more and more that there is a role perhaps for psychotherapy, meditation, yoga. Exercise is also great for stress. It releases really positive endorphins. Exercise, allows the heart to I wouldn't say compensate the stress, but to endure that. And then finally, exercise reduces the overall inflammation in your body, and inflammation is a major driver of heart disease. To answer your question in summary, medications is not the answer. It's the not the last ditch effort, but it's the third, fourth line in someone with heart risk factors. And at the cornerstone, the foundation, the fundamental aspect of healthy heart is on you, is on the patient to feel empowered, to take ownership of their life, and to take these little steps every day to improve their heart health.
I think what you said is, I guess, extremely important, that medication isn't everything and it won't solve all your problems. You still need to incorporate these lifestyle changes. And I think that's something that many people might not know about, whether it's they don't have to, like you said, buy a gym membership and work out for 2 hours straight just to see improvements. It's the little things that count, right?
That's right. It's the compounded concept of all these little things will add up. And they will notice changes, overall mood changes, overall blood pressure changes, like I said, glucose intolerance. But it has to be a very intentional, purposeful effort to introduce all these little baby steps into their life. It doesn't have to be a massive change. It could be something as small, like I said, walking 10 minutes after your meal. Incredible positive on your overall heart health.
And I know you mentioned about stress being an extremely prevalent factor in heart disease. Unfortunately, that's something, I guess, in society many people have experienced. And you spoke about how there's things like yoga that can help. And does mindfulness, has that shown to improve heart health in women in particular?
There are no, well, in my understanding, and I definitely, there's the space is so wide. This aspect of how can we modify stress or mitigate stress, and how can we mitigate it to prevent heart disease, is an emerging field, and it is also a major knowledge gap. I'm certain that mindfulness does help, but to what extent? In what form of the mindfulness? They've shown in the past that taking anxiolytics or antidepressants may not help overall cardiovascular health, but new studies are showing that there is, in the observational data, that there is improvement in or lowering of your risk of heart disease. In our own research, this is a major focus of my own research program, is to understand how stress drives heart disease and how eventually we can mitigate it. Will it be in the form of psychotherapy, lifestyle changes? Will it be in the form of other, augmented reality? There's a lot of devices. I'm aware of a company that offers a virtual augmented reality, goggles that help lower stress in patients who go for dental procedures, and it shows a lot of improvement. So I think we do have to think outside the box when it comes to this important risk factor. And but for sure, meditation, mindfulness, yoga, which leads to mindfulness, exercise, sleeping well. I think there's an important role for psychotherapy. We don't talk about it enough. It's unfortunate that psychotherapy, seeing a counselor, seeing a psychologist, isn't covered in our province. It's really offered to those who have private insurance, but eventually, if we could show enough data, the importance of stress and the role of mitigating it, it will become a policy change. That perhaps we can lobby the government to offer WHAMQ coverage for psychotherapy because it's so important. Yeah, and I'm so glad we're touching on this topic. I could do a whole like month on a whole other topic on the role of stress in the heart and ways that we can, as a community, try to offload it. How can we make this change happen? Yeah.
Well, thank you. I feel like that's very important what you're saying, whether it's diet, exercise, mindfulness, and like therapy, what you were talking about. I think these are all things that people can do out there. So thank you for that. And I guess to move on, let's talk about something exciting like the future.
Right.
Do you think are you excited for any advancements or research out there in the field of women's heart health that are emerging that you think are truly exciting for you as a researcher?
Yeah. I didn't share, but now I'm going to.
Please.
Locally at McGill, we a few years ago, along with my students, we founded the Power Hub. The Power Hub stands for Pathways to Cardiovascular Care for Women of Ethnic, Racialized, and Remote Communities. And it's really an initiative that we formed to bring to the next frontier different aspects of heart disease that I discussed today, and to find ways that we can mitigate it and improve it. And the Power Hub really is a collective collaboration of allied health professionals, students, community members, people from remote communities, from ethnic populations, etc., doctors, students, grad students, medical students. And we focus on, 4 pillars, and now we're adding a 5th one, of how do we tackle heart disease in women. The first pillar is advocacy of the Power Hub. Advocacy to us means, raising awareness, educating through social media platforms, through things like this podcast that we're doing, through in-person community events to raise awareness of heart disease, especially in the ethnic population or the remote minority populations. Another pillar of the Power Hub is research. So we do have a lot, because for me, and I need to stress the importance of research, is it goes back to a quote that my mentor, Dr. Barry Mers, once said, and she says, I can see women in my practice on a day-to-day, on a year-by-year basis, week-by basis, and I can impact the lives of let's say, to 1,000 women in my practice. But if I'm able to do research that can change guidelines, that will eventually change policy, then I'm able to impact the lives of millions. And so it's so important that the start of changing policy and to create understanding that can be perceived on a national, international level starts with really sound research. And in the Power Hub, we have studies focusing on stress and cardiovascular disease, recruitment of that in more diverse ethnic populations. We also want to understand how we can better diagnose those heart attacks with no major blockages in women. We're expanding in the future, and I'm always working with students, and so if anybody's interested, I want to expand to the space of different individuals going through the gender transition. I want to understand the changes that happen in the heart and individuals going through gender transition. And can we do something to improve the overall health? Because, anecdotally, I do see a lot of individuals in my practice who present with heart symptoms while on hormone changes. And I would like to know that if there's a way that we could prevent heart disease or offload their symptoms, can we do that? So lots of exciting research going on. With the Power Hub, we also have pillars related to finally philanthropy, philanthropy not meaning like donations, but we always need volunteers. We always need, when we go out to the communities to do our seminars, to do our what we call outreach, we always need students to raise awareness of heart disease, to do blood pressure checks with us. And so I do work with some of the med students already, but I'm always, our initiative is expanding, and we really want to be a community collaborative effort, and I can't do it alone. And then finally, one of our last pillars is we're expanding into the innovation impact space. And so what can we do to take all of these learnings, all this research, to create, resources or tools or devices that can impact heart disease? And we're at the tip of the iceberg, but stay tuned. So I'm super excited about the Power Hub. It's in its infancy in the last year and a half, and we're always welcoming new support, new members to be a part of it, because we think it's so important to do this outreach, to do the social media. And so, yeah.
I mean, it really sounds like you're breaking barriers with
Right.
so many important topics, whether it's about interventions or seeing how does the heart get impacted by so many factors. So it's amazing what you do. Is there somewhere people can go to see all this amazing research or events that you guys do?
Yeah. So we're definitely very up to date and fresh on the social media platforms. So we have our website. So definitely check out. It's called thepowerhub.org. On there, you can see our members. You can see the initiatives that we've been doing, our research, and previous activities and events that we've done, and also importantly, how to get involved. Our Instagram page, the Power Hub team, or Team Power Hub. On Instagram also is very up to date in terms of our upcoming events, our community outreach. We actually have an event coming up next February, for the month of February. It's the Women's Heart Awareness Month. On February 5th, we're doing in person as well as via Zoom talks and education pieces about heart disease in young women and the role of stress and how to mitigate it. So my own graduate students will be presenting these discussions, and I stress that these are trainee-led sessions because I really want to empower the younger generation. You know, I'm doing this podcast, it's fantastic, but what I really want is for young individuals in the generations before me or after me to really step up and to take the leadership. So we do a part of the Power Hub. What we do is also mentorship and guidance. I think it's so important to empower and instill confidence in the younger generation to also, take the baton, take the leadership, because eventually I want to, not that I want to step back, but I think it can't just be my role in isolation. So yeah, we have those events coming on February 5th. So please do register. It's also available on LinkedIn. We have a LinkedIn page, and then we're just expanding into our TikTok to even younger populations. So check out our website, thepowerhub.org, and check out our Instagram page.
To end off with one last question, Dr. Luu, is there anything you want our viewers out there to take away, or one big message you have for them?
Yeah, certainly, nationally there's a collective group of women, health experts and community members that's trying to tackle heart disease, the Canadian Women's Heart Health Alliance. And I'm a part of that, one of the executive members. And a few years ago, we came up with this slogan together that really gets at the nitty-gritty of heart disease in women. And it goes, in order to take care of others, you have to take care of yourself. It's so important getting at that fundamental concept of empowerment for you, but that you need to also understand yourself and to also prioritize yourself. And it really gets at responsibility. Ownership is on you. As a woman, we carry so many responsibilities, a sister, a mother, a daughter, a friend, colleagues, and there's so much burden that we have. But it's time, it's time, it's 2025, and the priority should be on you to take care of yourself, because as oftentimes the main member of the family only thrives if the woman thrives. And so I repeat it again, in order to take care of others, you have to first take care of yourself.
Well, thank you so much. I think that was a great way to kind of conclude this podcast. So just for everything, for your insights today, thank you for joining us today. Your work is truly inspiring, everything you're doing at the Power Hub. And we're grateful for the important strides you're making in women's heart health, educating and leading the future students, doctors, and patients towards a better heart health. So thank you so much for being with us today, Dr. Luu.
Yeah, thank you so much for having me, Derek. Thank you so much to the audience for listening. I'm so excited.
Thank you so much. And to our viewers, thank you for listening. And don't forget to follow our Instagram and Facebook at wham.initiative. And stay tuned for our exciting upcoming events and campaigns. My name is Derek. This is WHAMcast, and thank you so much for watching.
Thank you. Thank you.
Thank you so much.
Great.
That was amazing.
You did great. You did so great.
Wow, you did great.
Yeah, I rambled off and laughed.
No, it was perfect.